Thank you, Dr. Renee Perez, for joining the Baptist Health System today and answering some of the questions that we'll be going through. Appreciate your time. So July is Fibroid Awareness Month, and we had a few questions we're hoping you can answer and just kind of help spread some knowledge to our to your patients, to our patients, to the consumers. Can I ask you, what is a fibroid and how does it affect women?
So a fibroid, otherwise known as a myoma, is a muscle tumor of the uterus that arises from the middle layer of the uterus, and it can kind of wreak havoc with the patient's menstrual cycles and causing heavy bleeding issues, pain. They come in all shapes and sizes and can have multiple dramatic effects for a patient's life.
Who does this primarily impact? Is there a certain age group or?
There's a lot of different stats that kind of identify certain people that are kind of higher at risk. But for the most part, it does span multiple different age groups, from the young to the older patients. It just depends on how fast they grow and whether their location. It's not exactly just a certain age group. There are some patients a little bit more symptomatic than others. A lot of it has to do with the location, the size, that kind of thing, and what their fertility desires are.
What are the signs and symptoms of a uterine fibroid, and how can someone find out if they have one?
Most of the time, patients will present with heavy bleeding issues, as well as severely painful menstrual cycles. That's the most common complaint. At times when things become very complex, patients are getting blood transfusions because they've been bleeding so much. It's very common for me to meet patients that had no idea that their bleeding was abnormal or their pain was abnormal, and they're taking time off of work, or their cycles or their life revolves around their cycles. When things are getting that bad, it's definitely not normal.
You mentioned pain. Is the pain a constant, or is it mainly during a menstrual cycle?
Usually with the menstrual cycle, but it depends on the size of the fibroids too. If they're very large, it can be constant lower pelvic pain and or pressure the patients experience.
Are there any lifestyle risk factors and any lifestyle modifications that should be considered to help women who may be considered high risk?
Definitely seeking assistance and an evaluation from their OB-GYN is going to be very helpful. Like I said, a lot of times patients have no clue that their pain and or bleeding was abnormal. Some patients typically, they're not supposed to be bleeding greater than 7 days, but they are. But they've been doing it for years, so they had no clue that was abnormal. And or if they've had pain, they've been having it for a while. And they little by little have made changes in their life to accommodate the pain and the bleeding that they experience. So it's kind of by default they start making lifestyle changes that are not exactly that basically kind of disrupt their normal lifestyle. At least for a week out of the month, if not more. So it's not exactly something that they can do other than seeking assistance and asking their doctor, hey, is this normal? Because it's very common that patients just assume they've been doing this for years, that they, what their experience is normal. A great procedure has been out there for roughly about 13, 14 years now. It's a great procedure that's an alternative to hysterectomy for patients that really are not interested in hysterectomy for treatment of fibroids. It's under laparoscopic guidance. We're able to place it's laparoscopic ultrasound guidance. We're able to place a trocar into the fibroid itself and deploy an array of needles and basically fry the tumor from the inside out. And it basically denatures the proteins associated with the muscle tumor itself. So it's almost like, yes, the engine may still be there, but it's in pieces. So it no longer functions. It's not growing the way it was before. It's not as vascular as it was before. It's not as heavy as it was before. So patients have a dramatic treatment effect with that particular procedure. Success rates associated with laparoscopic CESA for treatment of fibroids are upwards of 94%. So a 6% failure rate, which is a very, very great treatment option for patients and a very good success rate with any kind of procedures. That it's very rare that any procedure can boast that kind of success rate without doing a hysterectomy. Not all patients need a hysterectomy whenever they have whenever they have fibroids, and I think that's a lot of the fear that patients have. They just or they're afraid they're going to that's the only thing they're going to be offered, which that's not the case at all. Nowadays, there are uterine sparing procedures that we routinely do on a weekly basis that are ideal for patients that absolutely really don't want a hysterectomy. That can span all age groups, whether they're in their 20s or in their 40s. There's ways to treat fibroids without doing a hysterectomy.
What does a recovery look like for some of these procedures? Are some of them that you do outpatient or inpatient, and what does the recovery look like?
For my patients' treatments, 99% of my patients go home same day, short of a complication. It's whether it's a hysteroscopic procedure or a laparoscopic accessa treatment or robotic myomectomy. Most of my patients go home the same day. With the advent of the ERAS protocols that we adhere to, managing our patients preoperatively, intraoperatively, and postoperatively, our patients do excellent with these procedures. And be surprised what we could do, with combining multiple different procedures, which is I routinely do hysteroscopy and laparoscopic accessa and robotic myomectomy and on patients all at the same time at times, to basically address the different problems that a patient has within the different layers of the uterus, and basically trying to restructure the uterus and making it more functional, whether it's because they want to become pregnant or or they just didn't want a hysterectomy at all. So there's patients do really well. Recovery for most of these procedures, roughly 2 weeks. And pain management. My patients with our ERAS protocol that my anesthesiologist team and I follow, most of my patients take very little narcotics.
Thank you. Well, thank you so much for answering these questions. We appreciate your time.